cigarette smoking was a habit, is a habit. It was a part of a behavioral pattern which was fed both by the aggressive marketing of tobacco products by the industry, but as well by the fact that there was no legislation to prevent that. The legislation came in and people kicked against it, the industry kicked against it, smokers kicked against it.
It's only the beginning. Great things are yet to come. Nizobon.
So we know that change doesn't happen overnight, but there's every now and again, there's like a really unique moment where there's leadership, where there's policies, where there's laws being considered that could really create more systemic change. And it took decades for us to undo the damage of the tobacco industry, explaining how these products have such a negative impact on our health. Now we're in this next phase where it's about taking away certain inroads industries making in terms of e-cigarettes, but also putting in place some final constraints that could actually really reduce the amount of smoking.
So we need a future. We don't need to destroy the environment. So tobacco destroys the environment.
Smoking is ruining young children. It is damaging the future generation. It is giving us pain, misery, and suffering. It is getting our air polluted, and people aren't realizing that. But we have to realize it. This generation has to fight for the next generation. We have to fight for our kids, our upcoming kids, our unborn sisters and brothers. We have to be one. We have to be united.
I'm saying to South Africans, implement the set of bills that is going to cut the expenditure on healthcare drastically, improve the life and quality of life of South Africans. If I can go have a meal without having to run around and the smoker takes the best part of the restaurant, my quality of life start getting compromised. We said, let it be 100 smoke free. All restaurants get away from the way where I would be inhaling the smoke. I'm saying let's regulate electronic cigarettes or electronic delivery devices. We're not saying we should ban it, and that's the impression they're giving to the public again. We're saying regulate it. If you do not regulate it, it may be less harmful to a smoker, but it may be more harmful to the population.
Some progress has been made, and we are hoping, DM, that there's going to be more speed to ensure that the bill is passed. Because without this bill, which puts measures that are strong, measures that will protect the youth, measures that will protect women, measures that will protect the elderly, measures that will protect any other South African, even the smokers themselves.
The single best thing you can do for public health in South Africa is to pass the Tobacco Products Control Act. It will reduce disease. We've already shown that. It will reduce disease, but it will also be economically beneficial. So what the Act will achieve is the following. It will make sure that young people do not start a lifelong addiction to a product that will eventually kill them. It will provide non-smokers with clean air. It will help smokers to stop smoking. And just as importantly, it'll stop the aggressive marketing tactics of the tobacco industry.
If you think about tobacco use and if you think about tobacco products, 16 cancers, 7,000 chemicals, why would you want your child to have this? Or why would you want to put yourself at risk of getting cancer? Cervical cancer kills more women in our country than breast cancer. It has such a high mortality rate. I don't think women know that if you smoke, it puts you at risk to cervical cancer.
So in so many ways, tobacco companies do increase that line, and and it's just like a never-ending cycle. And I think for us, it's really about thinking about how do you take an issue and move it beyond like a short-term viral win to a much more systemic win that will lead to a bit more justice.